As you go through this class, you're going to be asked to identify virtual slides that you've never seen before. And this is just basically our way of assessing how well you're grasping the histology concepts that you're learning through lecture and through WebMic. However, when you're first starting out in this class, these virtual slide questions can seem a little daunting due to the fact that you're given an entire slide with almost no frame of reference from us, except for the annotation asking you to identify a certain aspect of the slide. So, how exactly do you go about answering a virtual slide question that may at first seem kind of overwhelming? Well, this short video will go over some steps to help you get started with the process of how to think through these slides like a histologist. For example, I'm utilizing question 7 from your first practice lab quiz to help you kind of go through the steps. And I really highly recommend these lab quizzes to assess where you are in your understanding of the information that you're studying in WebMic, so that you will know if you need to review more material before taking your module quizzes. And the module quizzes are there to help you prepare to take your midterm and your final, which are weighted very heavily in this class. So when you get to the midterm and the final, you want to make sure that you know histology well enough to answer WebMic and virtual slide questions pretty quickly. And the better you get at recognizing the histology you're seeing, the easier it will be to orient yourself within the slide, which will greatly increase your chances of getting a better score on the virtual slide portion of your exams. So hopefully this video will help you out just a bit. Alright, so the first step is you're going to observe the slide under low magnification. This is so you can get a good overview of what the slide might be representing. Many times from lower magnifications, you're able to see enough details to get a good idea of what kind of tissue or organ that you might be looking at. For instance, this slide is epithelium of some kind because you can detect the layers of cells at the top of the slide that are characteristic of epithelium. Additionally, you can also see some connective tissue and some muscle tissue within this slide, both of which help confirm to me that this is probably epithelium, as you really frequently see muscle and connective tissue below layers of epithelium. It's pretty standard. All right, step 2. You're going to orient yourself. So why is it important to look at a slide under low magnification first? Because your first goal is to make sure that you've oriented yourself with the slide. I cannot repeat that enough. You have to get oriented with the slide. In other words, you want to make sure that you know what type of organ or tissue you're looking at before you begin to answer any questions that we may be asking you. If you orient yourself first, then you have a better chance of identifying specific cells and tissues and any characteristics of those that we may ask you to focus on. So, typically in a slide, you'll either see epithelium of some kind, and this is going to be epithelium of the skin or epithelium of some kind of organ, including arteries and veins and those kind of things, or you are going to see a slide from part of an organ with no epithelium present, or you're going to see a slide with a single kind of tissue, such as a blood smear. If you recognize that you have epithelium on your slide, you need to ask yourself the following questions. Do I have dead skin cells present on the topmost layer? Is there a lumen? Are there villi? Is there cilia? Basically, using these little characteristics can help you determine what type of epithelium that you're in, and that can kind of help you determine what kind of organ you might be looking at. So for example, if you see villi, then you know that you're looking at intestines. If you see dead skin cells at the free surface, then you know that this epithelium lines the outside of the body and is representing skin, and therefore it must be keratinizing. If there are no dead skin cells at the top of the free surface, then you know that this epithelium lines the inside of the body, and therefore it must be non-keratinizing. If you're looking at a slide of an organ, you should observe whether or not the organ is hollow. In other words, does it have a space or a cavity within it, which would be represented by organs such as like the bladder. If the organ's solid, you can look for visual cues such as a high presence of lymphocytes. The organ would stain very basophilic, as lymphocytes stain purple. And lymph nodes and the spleen are basically good examples of the type of organs that would contain a large amount of lymphocytes. If the organ is more acidophilic or a balance of both acidophilic and basophilic, that could also indicate to you what type of organ it might be based on your notes. Does the organ contain follicles, for example, the thyroid, or does it have a medulla and a cortex, which can be found in organs such as the kidney and adrenal glands? Lastly, If you're simply looking at a tissue, it helps to memorize examples of specific tissues that we have listed for you in your cell and tissues handout. It's best to keep track of organs that contain those tissues, and of course, if you have a blood smear, you can recognize those slides easily because they're going to have erythrocytes on them and a lot of space in between. And thus, after knowing that you're looking at a blood smear, you need to be keeping your eyes out for different types of leukocytes. All right. Now, most importantly, what you should get from this slide is that you need to be understanding that you need to keep track of these different identifying features that you're studying in your WebMic slides. If you take notes of these features when you see them, particularly when you see a new slide, then you'll know anytime you're looking at a virtual slide that you've never seen before that you'll easily be able to identify what it is you're looking at. So take notes of big identifying features of all the tissues and organs that you're studying, and you should be able to recognize them again in any other type of slide. All right, step 3 is very simple. You're just going to look over the annotation that regards to the question that we're asking. So right here, you're going to click this button right next to question 7, and it'll bring up this slide right here, and it'll show you the blue lines that the question is referring to. At this point, you may feel like you need to zoom in, and that's actually step 4, which is observe the slide under high magnification. You can either zoom in on the annotation itself, or you can zoom in anywhere else in the organ that might help you identify what it is you're looking at. So doing that for this example allows us basically to see that there are no dead skin cells at the free surface of this epithelium. Dead skin cells are characterized by a layer of flattened looking cells that have the appearance of having no nuclei, and these cells may be faint in color as they really don't take stain very well. The reason for the lack of staining nuclei is that the cells are not living, and therefore they do not have the molecular metabolic characteristics that would cause them to be attracted to a stain. So the lack of a layer of dead skin cells for this slide indicates that this epithelium lines something found inside the body. Additionally, we can also see the shape of the cells at the free surface as being squamous. And there are many, many layers of these cells, so we know that they're going to be stratified. And since we know that this epithelium isn't representing skin, it must be non-keratinizing. We know that the answer to this annotations question is going to be stratified, squamous, non-keratinizing epithelium, and that's the answer to question number 7. So hopefully this will help you kind of get started in figuring out how to answer those more complicated questions that you're going to start getting in your module quizzes. And just remember, the key here is to keep track of those identifying features of each tissue and each organ that you come across when you're studying in your WebMic, and then you'll be able to track then you'll be on track to successfully identifying histology slides for this class.